Welcome to Review Central. This is NCLEX Reviewer number 4, featuring questions on management of care. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN, or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Now let's begin. Question number 1. In a patient with acute cardiac tamponade, which of the following should not be done? A. Diuretic. B. Leg elevation. C. Volume expansion. D. Give 100% oxygen. The correct answer is A. Diuretic. A patient with acute tamponade do not have blood being pumped out of the heart because of the cardiac compression, thus fluid is vital. Thus, the patient should not be given a diuretic, since all diuretics increase the excretion of water from the body through the kidneys. Other treatment measures include oxygen, bed rest, and leg elevation. Immediate pericardiocentesis can be life-saving. Surgery requires making a hole in the pericardium and draining the fluid. Question number 2, in healthcare, what does the acronym PCP stand for? A. Perfected Case Planning. B. Patent Care Processes. C. Primary Care Physician. D. Protected Care Plans. The correct answer is C. Primary Care Physician. PCP is the acronym for Primary Care Physician. The PCP is the gatekeeper in many health care management services. Many plans and programs require the PCP to refer the patient for other specialties or services. The PCP is responsible for the overall care of patients as assigned by the payer. Question number 3. In which phase of the risk management process are performance outcomes and results reviewed? A. Step 1, Initiation. B. Step 2, Assessment. C. Step 3, Planning. D. Step 6, Evaluation. The correct answer is D. Step 6, Evaluation. The initiation phase is step 1 of the risk management process. Assessment and identification of potential risks is step 2 of the risk management process. Planning comes about in step 3 after potential risks have been identified and assessed. The final step of the risk management process is evaluation. This is when performance outcome and results are seen. Question number 4. Which of the following conditions should not breach patient confidentiality? A. Major depression. B. Harm to family. C. Harm to medical provider. D. Suicidal thoughts. The correct answer is A. Major depression. Confidentiality must be breached when there is potential risk to the patient or others, including oneself. Physicians and other healthcare professionals now have a legal duty to warn government authorities about suicidal thoughts despite potential harm to the therapeutic relationship. Major depression without suicidal risk is not currently seen as an adequate reason for breach of patient confidentiality. There was once a time when essentially nothing was thought to breach patient-doctor confidentiality, but today it is viewed as a partial and pliable, not absolute, barrier to government intervention. Question number 5. Which organization is the origin of movements such as Safe Staffing Saves Lives, Handle with Care, the 5 Million Lives Campaign, and the Coalition for Patients' Rights? A. National League of Nursing. B. American Nurses Association. C. American Academy of Nurses. D. The American Nurses Credentialing Center. The correct answer is B. American Nurses Association. The American Nurses Association, or A&A, originated Safe Staffing Saves Lives, Handle with Care, the 5 Million Lives Campaign, and the Coalition for Patients' Rights. The American Academy of Nurses serves the public and the nursing profession by advancing health policy and practice through the generation, synthesis, and dissemination of nursing knowledge. The American Nurses Credentialing Center is a subsidiary of the American Nurses Association that provides individuals and organizations throughout the nursing profession with the resources they need to achieve practice excellence. The National League of Nursing focuses on advancing excellence in nursing education by preparing the nursing workforce to meet the needs of diverse populations. Question number 6. Medicaid is for which population? A. Children. B. Disabled. C. Veterans. D. Low-income families. The correct answer is D. Low-income families. Medicaid is designed to help low-income families. It is funded by the state. Medicare, on the other hand, is for the elderly population. Question number 7. Which of the following expresses the acronym TANF used in Medicare? A. Total aggregate of new followers. B. Temperance Assisted Now Fellows. C. Temporary assistance for needy families. D. None of the above. The correct answer is C. Temporary assistance for needy families. Temporary assistance for needy families applies to the acronym TANF used in Medicare. Question number 8. Which of the following is not among the conflict modes used in conflict resolution? A. Accommodating. B. Competing. C. Avoiding. D. Kinship. The correct answer is D. Kinship. Kinship is a relationship by nature, character, or affinity. It is not among the conflict modes in conflict resolution. Inevitably, kinship exists in most conflict. Avoidance is a mode used to create an artificial safe environment that, all too often, ultimately manifests the very circumstances that were sought to be avoided. Accommodating usually manifests as one acquiescing to the needs or desires of another. If this is infrequent and genuine in spirit, the behavior can be helpful to a relationship. However, if it is ongoing and used to keep the peace, resentment will quickly result in unresolved conflict. Competing is a style and measure some take as an assurance that their needs are met. As an occasional measure it may not be harmful, but as an ongoing mode of resolution, others will find the measures taken to be overbearing and selfish. Question number 9. Which of the following is not true of IPPS? A. It is a DRG system that Medicare uses to establish payment rates for hospitalized patients. B. IPPS reimburses on a fee-for-service basis. C. Acronym for Inpatient Prospective Payment System. D. All of the above. The correct answer is B. IPPS is indeed the acronym for Inpatient Prospective Payment System. It is also true that IPPS is the DRG system that Medicare uses to establish payment rates for hospitalized patients. It is not true, however, that IPPS reimburses on a fee-for-service basis. Instead, IPPS reimburses on a per-discharge or per-case basis. Question number 10. Which of the following is not true of the definition of autonomy? A. Arbitrary exercise of authority. B. The right to self-determination. C. Decisions and activities selected by the patient. D. Patients have the right to determine their own best interest. The correct answer is A. Arbitrary exercise of authority is not a correct definition of autonomy. Autonomy is the right to self-determination. Patients have the right to determine their own best interest. Autonomy is the right of patients to make decisions and engage in activities selected by the patient once he or she has the information provided by authorities and experts. You have just completed NCLEX Reviewer No. 4, which featured questions on management of care. If you wish to watch more NCLEX reviewers on management of care, check out our NCLEX Management of Care Reviewers playlist. Check out also our other NCLEX playlist for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. Have a nice day.